Alright. Peripheral tissue is gonna unload the oxygen, pick up the waste, and then it goes into the lungs, unloads those waste products, picks up oxygen, delivers oxygen and runs through this. If blood is stopped or slowed, cells are engulfed by waste products. So if my cells are engulfed by waste products, what type of pH am I with? That's my number, yeah, acidotic, right? So oxygen delivery to tissues is disrupted, I'm gonna become acidotic, okay? Cells are gonna switch to anaerobic metabolism at that point, and they're gonna begin to die, okay? So, how can we use end-tidal in our waveform to help understand the patient's condition? What does end-tidal tell me?
If they're
If your patient is
offloading
Yeah.
CO2 properly.
Right, if I'm offloading CO2 appropriately, right, my off gas. So, we're gonna have different waveforms. So here's a normal one. Apnea, COPD, intubation is gonna look like that. So hypoventilation is gonna be happening towards the end, right? Decompensated shock. Hyperventilation, I'm compensating at that time, right? So if I'm breathing fast, right? What is my pH? What's my respiratory gonna look like for the pH?
High
alkalosis.
Alkalosis. High alkalosis is how we're going with. So if I have hyperventilation,
Acidosis causes that, but that causes alkalosis.
okay, so this is confusing, right?
It starts one way.
Every time that I read this, I'm like, I have trouble explaining it, and everyone has trouble understanding this, I feel like, because you have different numbers going in different directions, but we gotta understand this, alright? So, first things first, let's talk about hooking up our CO2, right? When you're in the field, and someone hands you an end tidal, how do I hook that up? Do I put it on the patient first or the monitor?
Monitors.
Right? So, I go back to this. I screw that orange thing into the life pack, right? It's gonna start making a line. Go all the way across. Once that line's connected, that means I can connect it to the patient. Okay, but it's just like if I were to go into a building for like a CO check, to see if there's carbon monoxide in the building. When I turn on my gas meter, I have to be outside the regular atmosphere, right? So I gotta let that gas meter get 21% oxygen, normal atmospheric numbers. Once I get that all registered, it's calibrated, then I can walk into the room and it's gonna tell me, do I have any high numbers, CO, hydrogen cyanide, things like that. So it's the same with our end-tidal. I have to connect it to the life pack, let it run through, calibrate, and then I can connect it to the patient. Once it's connected to the patient, I'm gonna be able to get my appropriate number, alright? So in the field, we're concerned with respiratory acidosis or alkalosis. Okay, the metabolic acidosis or alkalosis is gonna be done in the hospital. It's your blood pH, right? When you hear a nurse ask for lactate, ABG, that's what they're asking. Okay? We use end-tidal, we're not checking blood in the field. Alright? So we can use that waveform to predict and treat. Predict and treat. Okay? So there you go, there's neutral. If I go off how far in either direction from 7.35 to 7.45, once it's past how far is homeostasis altered?
It goes below 7.25
0.5 in either direction.
Yeah.
Right? So over 0.5 in either direction, we're gonna have problems. Alright, so this pH is just measuring how acidic something is. When you're referencing acidity, we're talking about excess hydrogen. Okay, that's all it is, excess hydrogen. Really means percentage of acids. Okay, so we need 7.35 to 7.45 to maintain homeostasis cells. 0.5 in your direction, not conductive to life. When we find somebody whose acid levels are not conductive to life, we gotta fix it. We counteract that problem to restore homeostasis, right? So you wanna keep the body in that neutral state. So, severe trauma. Where is my body heading? There's no one to fix it.
Is it audit?
Acidotic, correct, right? So I'm gonna start getting this one. Okay? Acid, too much. Lower than 7.35. Normal, 7.35 to 7.45. Alkaline's not enough, okay, so it's gonna be higher. You inhale oxygen, your body turns the oxygen to CO2, and you exhale and remove the CO2 from your body. Carbon dioxide is respiratory acid. If you're not breathing adequately, you're not getting rid of this respiratory acid. And it builds up in the tissues, which turns the blood acidic, right? The extra CO2 molecules combine with water in your body to form carbonic acid, increasing or decreasing. So let's make it simple. Hypoventilating is what? I'm breathing in what?
Slow.
Slow, right? So hypo, respiratory acidosis. My pH is low, my CO2 number on the life pack is gonna be high. So if I have 50 on my life pack, am I acidic or alkaline? Acidic, right? I'm breathing slow, my pH is going down, so those numbers are both down. So my life pack number is gonna be up, right? Hyperventilating is the opposite, right? I'm breathing fast, my pH number is going up, so I'm in alkalosis. But my CO2 number on the life pack is going to go up. So if I'm at 20, then I'm hyperventilating.
Don't change it.
And you would see the respiratory alkalosis if somebody's having like panic attack or something like that,
Correct.
and then they would have a chance of passing out, and when they do pass out, they'll retain the CO2, and in a sense,
You go back to homeostasis, right? Yeah. Yeah, so that's why sometimes it's like just let them pass it. If somebody's having a crazy anxiety attack, let them pass it. That's
Would
all.
would their SpO2 also be like at 100? Like,
Your SpO2, oh, it depends, man.
cause I did a ride once and this, like, they were like trying to differentiate if it was like a chest pain, or like a anxiety attack or something. And one of the firefighters said that if, like, you can tell, it was a pediatric, so they weren't gonna do the 12-week on her. But they're like, you can tell that she's having a panic attack or something, or anxiety, because her SpO2 was at 100 the entire time, it wasn't like fluctuating.
Yeah.
But also, he's like, sometimes you can tell from that. And I was just like, oh.
It's a good marker for you, for sure. I mean, like, if I'm having a real cardiac event, my SpO2 is not always gonna be great.
Yeah.
You know, it should be low. Now, I'd still do a 12 week, no
Yeah.
matter what, if it's pediatric or not, it's still shit. But, you know, if we have, see, we got this up here, right? We're hyperventilating due to trauma, right? That means I'm in what type of shock? Compensated, right? I'm in compensated shock at the time. So you show up right away to whatever the injury might be. This person's in compensated shock. They're breathing fast, their heart rate's fast, blood pressure's probably gonna be low. Now, as that starts to tank, then our breathing rate goes down, hypoventilation, and we start to become acidic because of the trauma. Alright? So we gotta understand that. My end tidal is above 45, I'm breathing slow, my respiratory acidosis occurring, that means my pH is low as well. pH low, hypoventilation, high end tidal CO2 number at work. That's my normal. Then this is the opposite, hyperventilation, right? So if I'm breathing fast, my breathing rate is high, my pH number is also high, and then this is gonna be low.
Is this PowerPoint in our 2.0 show, like yours?
Not mine, that's why you guys gotta pay attention.
Why do you-
Purpose.
Well, why not?
So you take notes and then you read your notes like I just told
But
you.
you going to do that?
Then tell me to slow down, I'll go back.
Fine, but you take a picture of the other one.
Take it, which one?
That
This one?
Yes.
Take a picture right
And then
now.
after that, the other one that it showed the waveforms.
Let me go back to. How much back?
Waveforms, yeah.
If you guys ever want me to chill on a slide, it's fine.
Can someone send that to the group,
Yes.
so we all have it? Thank you.
This one? No?
No.
This one?
can't we have oversight?
Because it makes you pay attention to class. And ask questions and take notes.
Okay, the next one. Wait, I think that's, whatever, I'll take it again. I know, that's great, okay, the next one. Sorry. Okay, this one,
You're gonna put that in the group chat.
yeah. Okay.
Thank you.
Alright, so we've heard review like we just talked about. Take a picture of it,
Pictures.
write it down.
You're the group for television.
I know, I'm this one.
So respiratory acidosis, my clinical presentation right here, altered level of consciousness, tachycardia, diaphoresis. Low or no respiration. In trauma, this is gonna be secondary, right, because it's decompensated shock here. This would be compensated shock.
Right.
Body's trying to compensate for its metabolic acidosis by producing a respiratory alkalosis on purpose.
I have a question, how does active hemorrhaging cause acidosis?
Think about
If they're breathing fine,
it, or they always gonna be breathing fine. Right, if I have a severe hemorrhage, I'm gonna compensate first, I'll be here. Right? I'm compensating, I'm breathing fast. My heart rate's going up, right? My body's trying to clot. So my body's fighting off whatever hemorrhage I have. So this happens first, I start breathing quickly. But because of that bleed, it will eventually become acidotic. Because what we talked about earlier, when the blood is returning to the heart, it's getting what? It's getting rid of waste products through the lungs, right?
Right.
So if that's not happening at an efficient rate, my blood becomes acidotic. For us, I really just want you guys to be able to read an end title number on your monitor and a waveform and understand what each number means, right? If I have a high number on my monitor, what does that mean?
Respiratory acidosis.
My number is 55 on my monitor. What type of breathing am I gonna have? Slow or fast?
it's just
slow.
Good.
Cause you're retaining more.
If my number is 15 or 20, what type of breathing am I gonna have? It's a kidney, right? That's what we gotta understand.
Going.
When we go back, this means
Well, I took a picture.
So respiratory alkalosis can you show up as feeling numb?
yeah. Think about it. How am I breathing? Like quick, right? So hyperventilating, like you asked before, about people having anxiety attack, when they start breathing real fast, you start breathing real fast right now, your fingers are gonna go numb. Why?
Because you're not getting enough oxygen to the
Exactly. Peripherally, I'm not getting enough oxygen.
so bleeding